mynews.studio.
Picture this. A mother in Cameroon watching her child play outside. No fever, no coughing. Could a new vaccine be the reason behind this change?
Today's date is October 16th, 2025. Malaria has been one of the top causes of death for children in sub-Saharan Africa. Just this year, Cameroon became the first country there to introduce routine malaria vaccinations for young children. But why Cameroon first? And what are the numbers showing so far?
The rollout started back in January, targeting children under 5. The numbers look promising. There's been a 13% drop in all-cause medical visits for this age group across the country. And in districts where the vaccine reached kids first, the drop was 17%. There's also a 13% decrease in deaths among children under 5 between 2023 and 2024. But can we attribute all of this to the vaccine alone?
That really is the core question. We're still waiting for a direct, proven link, right? But from what we're hearing, health workers and parents already notice fewer malaria cases in vaccinated children. Still, there have been challenges. Only about 37% of eligible kids got their first dose in the first month. Why weren't the numbers higher?
Part of it comes down to patchy data reporting. Some clinics didn't submit full reports, so actual coverage could be higher or possibly lower. Plus, there were logistical hiccups, especially in remote areas. But what really stands out is vaccine acceptance, 91% across Cameroon. How did they manage to reach that level of trust so quickly?
They built on existing childhood vaccination programs. Parents already trusted those clinics for other shots. And targeted communication was key, addressing rumors directly. Local leaders and health workers got involved, meeting families, answering questions in person. Do you think that's the main factor in overcoming hesitancy?
It plays a big role, but there are still regions where uptake lags behind. Usually, those are places where misinformation runs deeper or where health facilities are harder to reach. So, ongoing education and building trust remain essential. But looking ahead, what are the biggest challenges for Cameroon to keep this program going?
The main challenges are sustaining and scaling up. Cameroon wants to vaccinate 500,000 children by the end of 2025. That'll mean better data systems, solving cold chain issues, and securing enough funding. And crucially, keeping public trust strong. Now, for other countries, can they follow Cameroon's lead, or is this a unique case?
It depends. Cameroon's model, focusing on high-risk areas, getting international funding, involving communities, gives a useful template. But every country faces its own barriers. Things like infrastructure gaps, supply chain problems, or varying levels of trust in health services. Still, Cameroon shows it's possible to move quickly when all the parts come together.
Malaria remains the leading killer of children in much of sub-Saharan Africa. If this vaccine rollout succeeds, and if other countries adapt it, we could see hundreds of thousands of lives saved each year. Is this a turning point, not just for malaria, but for how we tackle other infectious diseases?
That's the hope. If malaria vaccination becomes routine, it could drive new efforts in global health, especially for long-neglected diseases. Cameroon's experience shows that with strong coordination and trust, big health goals are within reach.
And that's why this story matters. It's an example of what's possible when communities, governments, and partners work together. If Cameroon can do it, what's holding others back?
So today we explored Cameroon's malaria vaccination program, the early impact, the obstacles, and the lessons for the continent and beyond. Thanks for joining us as we followed the data, the stories, and the hope behind the headlines.
Thank you for listening. This episode comes from mynews.studio. Try it out for free.